As Barbadians prepare to engage in more outdoor activities now that some COVID-19 restrictions have been eased, doctors are warning that we still need to protect ourselves from another hazard, volcanic ash. And even though an excellent job is being done to clean up ash blown here from the La Soufriere volcano, it's the lingering ash in the air, in open spaces and on plants that we still need to be concerned about. Eventually, face-to-face classes will resume for some children. Dr. Angela Jennings, head of the Paediatrics Department at the Queen Elizabeth Hospital, is encouraging parents to protect their little ones.
I think as a country we've done significantly well in terms of preparing the schools with respect to cleaning of the schools, etc. But the ash is going to be around for a while. You know that even though you've cleaned, you can see when you drive in the streets, it still is being redistributed. It's on the vegetation, and we haven't had a lot of rainfall, so it's still very much in the environment. So mask wearing is going to be important, and not only just any mask. You want a mask that is well fitting, so that you minimize the particles coming into the area of the child. And obviously as well, things like hand washing, hand hygiene, just what we've been doing for COVID will continue. And what is going to be important will be the constant cleaning of these surfaces to try as best we can to remove the dust. So for the parents, they must have masks for going back to school. We still using hand hygiene. And if the kids, take off their masks or their hands get dusty, they're going to be asked to wash their hands and wash their faces. If they're feeling like sniffly or their eyes are itchy, you're going to wash your hands and then wash your face before you put your hands into your eyes.
Inhaling volcanic ash can cause short and long-term complications to children and adults.
The ash, as you know or would know, is not just fine dust. It actually is made up of silica, and it's got rocks and different minerals. And the issue here is if you inhale that, what impact it can have on the kids. Now, obviously the children are shorter than adults, and with the ash fall, they're closer to the ground. So the likelihood that they may breathe in the ash is going to be greater. So that's why we would have recommended staying indoors, etc., and wearing masks. The impact on children is just as it is with the adults, with the fact that they can have significant respiratory symptomatology, they can cough, they can wheeze. And we know that this is especially so in the kids who have underlying respiratory issues, for example, asthma. And that's why we would have recommended that these kids continue to take their medication as would have been prescribed before, because the respiratory issues are going to be significant. It can also affect their eyes. They can get the ash going into their eyes and causing them to rub their eyes. The eyes can water. Their nose as well. They can actually have runny nose, they can sneeze, etc., and they can have sore throats. And these are the acute issues that we would expect to see with respect to the volcanic ash. We know that the risk of prolonged exposures, particularly the silica within the volcanic ash, can lead to long-term lung complications, but obviously we've got limited data for that in children. So a lot of the acute symptoms are more what we would anticipate and look out for at this point in time.
Despite the presence of volcanic ash, there hasn't been any significant increase in the admissions of children with asthma to the Paediatrics Department of the QEH.
We have been mask wearing, staying away from others, being indoors. I think that has put us in very good stead to deal with this volcanic ash. We have had, in the last year, because of the COVID, our numbers for patients with asthma have been significantly reduced. We've not seen significant, the usual numbers that we would have seen in terms of children admitted with asthma, and that continues to be the case. We've had only 2 children really who were admitted recently because of volcanic ash. Obviously any child is something that we would not want to see, but our numbers have been down. I want to say kudos to parents and all those out there who are looking after children, who have done as we want them to do in terms of keeping the kids safe. In addition, we would have called our severe asthmatics just to see how they're doing and making sure that we remember to take your medication and that we use the medication correctly to minimize the risk that this ash would have a significant impact on them. And to date, we have not seen that borne out as a significant issue for our asthmatics. So we are happy from that point of view.
To learn more about the dangers and benefits of volcanic ash, follow GIS Barbados on Instagram and Facebook, or visit our website at gisbarbados.gov.bb.